Hello everyone. How are you guys doing today?
Hello, sir. Doing well, sir.
How are you, sir?
I'm good. How about you?
Fine, sir. Very nervous about exams and everything, as always.
When is your exam schedule?
So I have not taken the date yet, but it's only the block, and my block ends in on December.
Mm-hmm. So have you done any assessment exams, any NBMEs?
I just did one NBME exam. So the last time you conducted the May batch one,
Mm-hmm.
and I'm thinking I'll do the next like 28, 29 up to 30 on the next week, sir. Right now, I'm
Okay.
just revising FA. So one last time, I just want to revise, and then I want to give the NBME, sir.
Okay. So how much did you score on the first NBME?
It was 144, sir.
144. So it's got to be around 60, so 70%, right?
Yes, sir.
Yeah, that is actually kind of borderline. You need to do like you can pass with this in BME score, but you still need to do some improvement.
Yes, sir.
Make your score around 74, 75%, so that you could be on the safer side.
Okay, sir. Okay, sir. Yes, sir. I will do that, and then again I'll contact you and take your advice again, sir. Thank you so much.
Sure, no problem. You can reach out to us um, regarding any help. Okay.
Yes, sir. Thank you.
All right. So let's start our session. Today we are going to start another group of bacteria, which are called gram-positive rods. Right? We did the gram-positive cocci in our last session. Today we are going to discuss the gram-positive rods. We'll try to cover most of them. Okay. So, how many people have done? Okay. All right. Let me share my screen. Can you guys see my screen?
Yes, sir.
Yes.
All right. So who's going to read the first question for us?
Which of the following best describes the mechanism of action of the toxin responsible for the necrotic effects seen in this patient? A 27-year-old man comes to the emergency department due to several hours of right foot pain and swelling. The patient says he was working in his barn last night and stepped on an old nail. This morning, he woke up with a pain near the injury site. It was increased throughout the day and is accompanied by progressive swelling. The patient has no chronic medical conditions and takes no medications. The temperature is 100 degree Fahrenheit. Blood pressure is 135 on 75, and the pulse is 95 per minute. The right foot is swollen with some erythema around the injury site. Radiographic imaging reveals gas. Surgical exploration shows extensive tissue necrosis, and the site reveals gram-positive rods. So it's a Clostridium perfringens.
All right. Before discussing this question, let's have some discussion on the gram-positive rods. Okay, so that will make things easier for us. Let me just open my notes. All right. So talking about the gram-positive rats, is going to tell me the important bacteria that are gram-positive rats. Mm-hmm.
So, Clostridium,
Okay, first of all, we have
aerobic, anaerobic.
the Bacillus species, right? And then we have the Clostridium. What else? We have
Listeria.
we have Corynebacterium, the Corynebacterium diphtheria. Then we have um, Listeria, and another one which is not very high yield. That's called Gardnerella, right? In Bacillus, we have two important bacteria. They are Bacillus anthracis and Bacillus, which other one? Cereus, right?
Yes, sir.
Then we have Clostridium, four Clostridia species. Who is going to tell me? Mm-hmm.
Clostridium botulinum, Clostridium perfringens, Clostridium welchii, and Clostridium
Tetna.
tetani.
We have the Clostridium tetani, Clostridium botulinum, right? We have Clostridium perfringens and Clostridium difficile or C. diff, right? Then we have the Corynebacteria, diphtheria, Listeria, Mansa, and Gardnerella, right? These are important gram-positive rats, okay? All right, so there are some important characteristics shared by these bacteria, okay? So some of them are aerobic and some are anaerobic, right? Then there are some spore formers and non-spore formers, right? So which of these are aerobic? So we have the Bacillus anthracis, like the Bacillus species is actually aerobic, right? Then we have the anaerobic, which are Clostridium. Uh, Clostridium are the rest of them are actually anaerobic except the Corynebacteria. Okay. Then we have spore formers. So the Bacillus and Clostridium genuses, all of them are actually spore formers, right? And then these are non-spore formers. Okay. So these are some important characteristics that we need to keep in mind as as you are going to be tested on these in your exam. Okay. All right. Then uh, also one important differentiating points among these are the Clostridium and the Bacillus. They are actually longer, and the other species, Corynebacterium listeria, they are shorter and more deeply standing. Okay. All right. Now, let's start with the Bacillus. Okay, Bacillus anthracis. So we have Bacillus anthracis and Bacillus cereus, right? So, what important disease is caused by Bacillus anthracis? Who's going to tell me? Mm-hmm.
Anthrax.
Yeah,
Respiratory tract or pneumonia.
it causes a disease called anthrax, right? And this anthrax comes in three forms. So it causes disease in three forms. It causes disease in cutaneous, then pulmonary. We are going to discuss each of them, okay? And then gastrointestinal. All right. Important properties of Bacillus anthracis. It's as we already discussed, it's a longer gram-positive rod. It is um, aerobic, okay. And the another important property is they are spore farmers, okay. Uh, Most highlight point is they have got this polydglutamate capsule, okay. Most of the bacteria that you will see, they have capsule made of a polysaccharide, but in case of Bacillus, it is made of polydglutamate. It's basically made of protein. Okay, it's an obligate aerobe. It survives only in presence of oxygen. Okay, it's also a spore farmers. All right. So about the transmission of Bacillus anthracis. So where are the spores from Bacillus anthracis found? Mhm.
Your source is animal, like this is commonly contact from the animals.
Yeah, actually,
Inhale to the respiratory tract.
yeah. So the spores are actually found in soil, okay, and they can get into the animal pool, like in sheep or other animals, okay. They can also get into animal products, especially like the wool and bristle, etc. And from there, they can be transmitted to human, okay. It's basically a disease of animal, but sometimes when the spores are transmitted to the human, it can cause this anthrax disease, okay. So those individuals who are doing farming or handling these animals, they sort of get are exposed to this disease, okay. All right. So cutaneously a person can be infected if there is a wound and it comes into direct contamination with soil, so it will cause cutaneous manifestation. What is the cutaneous manifestation of Bacillus anthracis? Mm-hmm.
Blackish color.
Yeah, it causes a black eschar, right? So there will be like central necrosis, right? And there will be a lot of erythematous. There will be a big erythematous ring around the this central necrosis, right? So black eschar is one of the cutaneous manifestation of Bacillus anthracis. Okay. If this okay, if there is inhalation of this of the spores into the lungs, then it can cause uh, pulmonary manifestation. Okay, and it manifests as pulmonary anthrax, right? What do we have in pulmonary anthrax?
Hemorrhagic mediastinitis.
And flu-like symptoms.
Sorry.
flu-like symptoms.
Yeah, perfect. So the person will present with non-specific respiratory symptoms like that of influenza, like dry cough, um, maybe some fever, right? And substernal pressure. And if it's not treated on time, then it can go to hemorrhagic mediastinitis, right? So on chest X-ray, uh, you will see um, what you will see on chest X-ray. You
White mediastinum.
yeah
Widened
you,
mediastinum.
yeah you will see a widened mediastinum, right? So in case of pulmonary anthrax, the person presents with non-specific symptoms like influenza with dry cough, fever, and some substernal pressure. It can then progress to hemorrhagic mediastinitis, hemorrhagic meningitis as well. On chest X-ray, you will see this is the diagnostics criteria. You will see a widened mediastinum, right? All right. Also, if these spores are ingested, then it can manifest as gastrointestinal symptoms. So, what do we have in GI pulmo anthrax? Mm-hmm.
Hematemesis or melena.
So, person actually present with vomiting, and it is ingested with contaminated meat. Okay, so these are the clinical manifestation of um, anthrax. Okay, all right. Now talking about the pathogenesis and important toxins produced by bacillus. So who's going to tell me the important toxins produced by Bacillus anthracis?
The lethal
So,
factor, the factor.
yeah, it produces two toxins, edema factor and lethal factor, right? What is the mechanism of action of edema factor?
Edema factor acts as adenylate cyclase,
Yeah,
increases
yeah, it acts as a adenylate cyclase. Okay, perfect.
increases CAMP
Yeah, it increases the amount of CAMP
and
and causes edema and all these characteristics. Like mostly, it's um, all right. So this toxin actually comes in a B configuration. So we have an A subunit, an A unit, and then we have an active subunit, okay, and we have a binding subunit, right? What is the function of binding unit? It's also called protective antigen because um, it actually uses this B subunit to attach to the host cell, okay? And it makes these spores over here, which helps the toxins to enter into the cell, right? So it's also called protective antigen. And part of the reason we call it protective antigen because we can make vaccine against into this binding unit. Then we have this active subunit. It is like this subunit, for example, in case of edema factor, we have this adenylate cyclase, which increases the CMP, causes edema, and mask the host cell defenses, right? What is the function of lethal factor? Mhm. So it's actually a protease, okay, and it activates MAP kinase, okay. So it cleaves the MAP kinase, and what does the MAP kinase do? It's a signal transduction protein, and cleavage of this phosphokinase actually inhibits the cell growth, okay. So it causes necrosis, right? So in case of like black scar, for example, there is a central necrosis. The necrosis is caused by lethal factor. We have uh, an erythematous ring, and the arenal cyclase increases. It causes edema, and all those. So we have increased CAMP, which causes edema, right? So both of them actually work together, right? All right. So, did you guys understand this till now?
Yes.
All right. So what is the treatment? So we give fluoroquinolones or doxycycline in case of so we give cephaloxacin or doxycycline in person infected with bacillus. Okay. All right. Just few words about the bacillus series. Okay. So bacillus series, important thing about this is it cause food poisoning. Okay. All right. Bacillus series also, it actually, um, it actually, all right. So the bacillus series, when rice is reheated, it actually is found in starch food, like high carbohydrate food. So it's most common causes reheated rice. Okay, so reheating rice actually causes these spores to germinate. Okay, when it is kept warm for many hours. It manifests is food poisoning. Okay. Also, Bacillus anthracis. It's um, the clinical manifestation will be a lot of vomiting instead of diarrhea. Okay. It also produces two enterotoxins. Okay. So um, one of the toxin has the same mode of action as that of cholera toxin that we will discuss in our upcoming discussion. Okay, and it actually work is by ADP ribosylation. It work by ADP ribosylation. Okay, so it adds adenosine diphosphate ribose to a G protein, and it can stimulate this it then activates this adenyl late cyclase, and what you already know, what does the adenyl late cyclase do? It increases the CNP, which causes a lot of fluid to go out of the cell. So it manifests as it causes a lot of edema, right? Um, the other toxin, it has the same mechanism of action of that of staphylococcal that we discussed yesterday. So it acts as a super antigen, right? So these are some important high points that you need to know about the Bacillus cereus. Okay, so Bacillus cereus, it causes food poisoning. due to reheated rice and manifests as vomiting. Two important toxins are cholera, which cholera-like toxins, which works by ADP ribosylation. It activates adenylyl cyclase, increases CAMP, and causes a lot of outpouring of fluid. And the other toxin is staphylococcal toxin, which is a super antigen. Okay, so did you guys understand till now? I should revise.
Yes.
All right, perfect. Now, talking about the Clostridium species. Okay, so we have Clostridium tetani, botulinum. Then we have Perfringens and Clostridium difficile, right? So Clostridium tetani. Okay. So important characteristic of Clostridium genus is they are anaerobic, okay, and they are spore formers, right? So the first species is Clostridium statini. Okay. It's a gram-positive rod, as you guys know. It's an obligate anaerobe, okay, and it's also a spore farmers, right? All right. Where are the spores of Clostridium tetani found? Can anyone tell me?
They are in the soil like the animal byproducts, like animal pieces,
No.
the tetani, like
They're also found in the soil, okay, and it is introduced into the body during.
Not in packaged. No, no, that's
No,
body.
no. That is actually you're talking about the Clostridium botulinum, right? We are discussing the Clostridium tetani. So the spores of Clostridium tetani, they are found in the soil, okay, and most commonly they are introduced into the body during like at a wound site, okay. For example, when there is penetration by a nail or um, um, okay, um, they can also be introduced into the body by a skin popping technique used by IV drug users, right? Okay. Also, since they are anaerobic, right? So they actually germinate in an area of the body where there is less blood supply. For example, a necrotic tissue, right? So they'll germinate over there. There is another form of Clostridium tetani called neonatal neonatal tetany, right? Uh, in neonatal tetany, the spores get into the neonatus um, through a contaminated umbilicus or through a circumcision wound. Okay, so neonatal tetany is also very important. Okay, all right. So this was about the transmission of Clostridium tetany. Now, talking about the toxins produced by the um, Clostridium tetani. So, who is going to tell me the important toxin produced by Clostridium tetani?
Tetanus plasmin.
Yeah, it's called tetanus toxins or tetanus. Spasmin, right? What is the mechanism of action of tetanospasmin?
It's neurotoxic.
Yeah.
Block GABA transmission.
Yeah, it blocks GABA and glycine in the Renshaw cells.
Yeah, that's right. So what happens is, for example, if a person uh, put his feet on a nail, so it actually makes a portal of entry into the body. So what happens is, for example, over here we have a neuromuscular junction, right? So for example, if this is the muscle, right? Here we have the motor neuron, right? So once this tetanus toxins get into the body, okay, so it is taken up by these motor neuron, okay. So it can go in a retrograde axonal flow into the central nervous system, like spinal cord, okay. So for example, over here we have our spinal cord, right? So they can go into this spinal cord, where here we have these alpha motor neuron, right? So what happens is, once the toxin is introduced into the body, it can be taken up by these motor neuron. It then go in a retrograde axonal flow, right? And reach up to the spinal cord. We have some specialized cells over here. So we have these, let me draw it in a different color. So we have these specialized cells over here in our spinal cord. These are called Renshaw cells, right? What is the function of these Renshaw cells?
They are inhibitory neurons.
Yeah, they are inhibitory neurons, so they release two inhibitory neurotransmitters, right? What are these two inhibitory neurotransmitters?
GABA and glycine.
GABA and glycine, right? So the function of these inhibitory neurons is to produce these GABA and glycine. As you know, a body in a normal state, they are um, in a stimulated form, they actually fire. So these Renshaw cells are these inhibitory neurotransmitter. They help to inhibit this Uwer firing. Okay. So for example, if these Renshaw cells are inhibitory neurons are absent, so the body will be Uwer firing. Okay. And the person will be in a spastic condition, right? So over here, these Renshaw cells produce these GABA and glycine to maintain the normal state of the body. They actually keep under control the body from overfiring, right? So these Renshaw cells, they have these synaptic vesicles right over here. We have these GABA and some of neurons have glycine, right? So these GABA and glycines, they have an important protein What is the name of the protein?
Snare protein.
Yeah, it's called snare protein. Perfect. It's also called synaptobrevin. So we have these T snare and V snares. And what is the function of these snare proteins? They actually help in the exocytosis of these GABA and glycine from the cells. Okay, so once this tetanus toxin or tetanus plasmin they reach the spinal cord, so they, it works as a protease and it actually cleave this snare protein. So no release of GABA or glycine is there will be no release of GABA and glycine. Okay, so the body will be in a state of overfiring, right? So it manifests as the body go into a spastic paralysis state, right?
Yes.
Did you guys understand?
Yes.
Anyone who did not understand this pathway? I need to turn off your mic. Okay. But we are good. All right. So there will be no release of GABA and glycine, so the body goes into a spastic paralysis state, right? So the person is going to present with which clinical signs? Mm-hmm.
It's muscle spasm, rigidity.
Yeah, the person is going to present with a sign. So that they'll have locked jaw. Okay, so he's not going to, he will not be able to eat food or drink water. This is called trismus. Okay, other clinical manifestation is rhesus sardonicus. Okay, it's called evil smile. Another important sign is opisthotonus. What happens in opisthotonus? Person will have an exaggerated arched back. Okay, and all this is due to this no release of GABA and glycine. Okay, all right. So let's also discuss the Clostridium botulinum. It's also the work by the same pathway, but as you know, the tetanus toxin, it works in the central nervous system. Okay, but the Clostridium botulinum, it works on the peripheral nervous system, right? So this Clostridium botulinum, once it gets into the body, it will go to this motor neuron over here. It will also be taken up um, by the motor neuron over here, but it cannot go in a backward, like in a retrograde axonal flow. So it will exert its function over here. Okay, so we have the same snare protein over here, but there is another neurotransmitter over here. What is the name of that neurotransmitter?
Acetylcholine.
Yeah, it is acetylcholine, right? So it was like there is a snare protein over here. So it will actually cleave this snare and it will inhibit the release of these acetylcholine into the neuromuscular junction, right? So there will be no action potential in the muscles and it causes a flaccid paralysis, right? The mechanism of action is the same, but one works in the central nervous system and one works at the peripheral nervous system and the neuromuscular junction side by inhibiting the release of acetylcholine. If there is no acetylcholine in the neuromuscular junction space, so there will be no acetylcholine um, to stimulate the muscles, and there will it will manifest as placid paralysis, right? All right. So now, um, this Clostridium tetani, they actually form a type of spores called terminal spore. Okay, and the Clostridium botulinum, they form subterminal spore. Okay. So terminal spore meaning the spore will be at the end of the rod. For example, like this is our cell, this is our spore, right? So the spore would be right here. Okay, subterminal spore would be like here, and then we have a central spore which is over here, right? All right. Now the treatment of tetanus. Who is going to tell me the treatment?
Antitoxin.
Yeah, we gave antitoxin, right? So this tetanus antitoxin, or it's an immunoglobulin, right? It is used to neutralize the toxin, right? Um, the person will also need some respiratory support since they can go into respiratory failure. So we can give ventilatory support along with benzodiazepine, etc. Okay. It's just we have tetanus toxide available, which produce immunity against. It is usually given to children, um, in combination with another toxide, diphtheria and pertussis, right? We call it DTaP. So we give DTaP in combination with this. Okay. So if there is any when there is any trauma occurs, so the wound should be clean and debrided. Okay. If there is gross contamination, then we give the tetanus antitoxins or the tetanus immunoglobulin along with the toxide booster. Okay. Also, in order to prevent the neonatal tetanus, we give tetanus toxide in pregnancy as well. Okay. All right. So this was a little discussion about the Clostridium tetani. Now let's discuss the Clostridium botulinum. Okay. So you guys know Clostridium botulinum. It's also gram-positive rods and anaerobic, and it also form these spores, right? It is found in the soil and it can contaminate vegetables and meats, etc. Okay, so the important high risk foods are alkaline vegetables, like for example, green beans, peppers, and mushrooms. Okay, and it can also contaminate smoked fish. Okay. High risky foods are since they are anaerobic, so um, they actually prefer an anaerobic environment. So any foods which are canned, so canned foods, as well as vacuum packed foods without adequate sterilizations, these spores can survive and germinate, right? And then these spores, once these spores germinate inside these canned food or vacuum packed foods, they will produce these toxins, which is called botulinum toxin, right? And then it manifests these different diseases. Okay. All right. I already talked about the pathogenesis. I told you that the botulinum toxin, it gets into the peripheral nervous system and blocks the release of acetylcholine, right? So you'll also have all these nicotinic and muscarinic block symptoms like dry mouth, ptosis, the 3Ds, dysphagia, dysphonia, and what other? Um, so you'll have all these,
Diplopia.
yeah, diplopia, right? So you'll have all these signs and symptoms of muscarinic or nicotinic block, right? All right. So we have two types of botulism. Botulism. We have wound botulism, in which the spores contaminate the wound and germinate there, right? And we have infant botulism, right? So it will actually the classium botulism, it will causes flaccid paralysis, right? In contrast to the classium tatani, which causes spastic paralysis. It will be an ascending or descending paralysis.
Descending.
Yeah, it will be a descending paralysis. In which other condition do we have ascending paralysis?
GBS?
Yeah, GBS, Guillain-Barré syndrome, right? So, for example, a family presenting with this signs of diplopia, dysphagia, and all these symptoms of placid paralysis, and it's also descending, so it will be botulism, right? All right. Also, please note that um, Clostridium, the botulism in adults is um, uh, due to the direct action of the toxins, right? For example, like if there is like once um, once a person consume these vacuum or canned food, um, they will ingest these toxins, they get into the GI tract, and then they cause all these clinical signs and symptoms. In case of children, um, it is due to the ingestion of spores, right? So, for example, if a large amount of honey is used by infants, they don't have a robust flora of the gut, which can outcompete these spores. So these spores actually germinate in the gut of the infants, and it then causes this infant botulism or floppy baby syndrome, right? So there is important difference between the adult and the infant. In the adult, the disease is actually caused by direct action of the toxin um, which have been produced in the canned food. In infant, since there is no robust flora of the gut, so when spores get into the GI tract, they germinate over there and causes and produces these toxins, right? So did you guys understand the Clostridium botulinum?
Yes.
Okay, so what are the uh, commercial uses of this Clostridium botulinum toxin?
Cosmetic Botox.
Yeah, we give it in a Botox therapy. Mhm. So it could be used to treat a number of conditions, for example, torticollosis, right? Torticollis, maybe blast, what is that called?
Blepharospasm.
Yeah, blepharospasm, right? So when we can use commercial preparation of um, this botulinum toxin and can use,
Wrinkles.
yeah, we can use it to treat wrinkles. Also, it is used to treat a condition called writer's cramp. Okay,
Painful bladder too.
yeah, painful bladder. Okay, so all those conditions where there is like um, extra muscular contraction, we can use it to relieve the muscle, right? All right, we have two other bacteria left. Let's just quickly go through them,
What
okay?
is, sir, what is this writer cramps? It's just like a muscle cramp?
Yeah, it's a muscle gram. Like in some of the writers, they cannot write, okay?
Oh, this is
Um,
writer cramp. Oh, yeah, got it.
yeah, it's a
Like
writer.
with the writing, like the hand
Yeah,
becomes fast.
yeah, that's right.
Okay, thank you.
All right, now talking about the Clostridium perfringens, okay? So Clostridium perfringens, so causes it causes two diseases, right? It causes a condition called gay skin greens, or it is also called, what is the another name? Mm-hmm. It can also cause food poisoning. Gay skin is also called clostridial myonecrosis, right? So this gay skin green or myonecrosis is also a form of necrotizing fasciitis. Is caused by this Clostridium perfringens, okay? And what happens is um, the spores, they are also found in the cells, okay? So when there is some accidents, for example, in RTA or automobile accidents, there is war in combats, war wounds, right? Or there is a septic abortion, these spores can get into the body, okay? So, what happens is these, since they are anaerobic, so they will obviously survive and germinate in areas where there is low blood supply or low oxygen, right? They'll germinate there and then they will produce some toxins, right? So an important toxin produced by Clostridium perfringens is called, what is the name?
Alpha toxin.
It's called alpha toxin, right? Where else we did discuss this alpha toxin? It's also called lecithinase. This alpha toxin was also one of the toxins produced by the Staph aureus, right? I told you there were two toxins, the leukocidine, right, which kills the cells. There was an alpha toxin and there was a PV leukocidine, right? So it's the same alpha toxin is specifically called lecithinase, okay? And it damages the cell membrane and split these phospholipids. Okay, and also can it can also lyse these erythrocyte and causes hemolysis. All right. So one of the toxin is this alpha toxin. Then it also has some enzymes, okay, which produces hydrogen gas. So it the person present with the gas gangrene, right? With a gravitas. If you examine this wound, you will hear a gravitas sound. Okay. So an examination, you will see this gravitas, and it is due to this gas formation by the degradative enzymes, right? It also causes hemolysis, so the person can present with jaundice and anemia, right? All right. So also, on lab examination, you will see a double zone of hemolysis. Since it causes hemolysis of RBC, so you will see a double zone of hemolysis. Um, the treatment is penicillin G. Okay. Um, all right. So this was discussion about the Clostridium perfringens. Now let's quickly go through the Clostridium difficile. So Clostridium difficile is also a spore formers, right? And what are the two important risk factors for Clostridium difficile? Mm-hmm.
Toxin A and B.
Chronic
Antibiotic use.
antibiotic use.
Yeah, chronic antibiotic use. Important antibiotics are clindamycin, cephalosporin, etc., and not washing hands, right? So these are important risk factors. It causes a condition called pseudomembranous colitis. Toxin produced by class C. diff or exotoxin A and exotoxin B, right?
Yes.
So chronic antibiotic use actually suppress um, the normal flora of the colon, and it allows the C. diff to multiply and produce these exotoxin A and B, right? So um, specifically this exotoxin B, it causes deep polymerization of actin filament, right? So it causes deep polymerization of the actin filament and causes the loss of cytoskeletal integrity, causes apoptosis, and death of the enterocytes. And this A actually binds to the brush border of the intestine. It actually targets these brush borders, right? And causes inflammation, cell death, and watery diarrhea. So these are the two important toxins produced by C. diff, right? So the person is going to present with these pseudomembranes, and they are actually these yellow white flags of the colonic mucosa, okay? And the diarrhea will be non-bloody. So it is a watery diarrhea. And there will be leukocytosis, or there will be a lot of neutrophils. Okay. So this was something about the C. diff. Treatment. Who is going to tell me the treatment?
Oral vancomycin.
Yeah, the first line of drug is vancomycin, right? And we also give another drug.
Metronidazole.
Metronidazole.
No. Wait.
Sorry?
sir.
Yeah, it's first line of drug. Another drug we give fidexomycin, right? So these two are the important drugs we use. Okay. So this drug actually they concentrate in the colonic. They don't get into the blood, so they concentrate in the colon. So it is narrow function, right? So did you guys understand till now?
Yes.
Yes, sir.
All right. Now let's come to our question. So this patient presented with right foot pain and swelling. Was working in his pond last night and stepped on an old nail. Um, there was progressive swelling, did not take any medication. Right foot was swollen with erythema around the injury site. Radiographic imaging reveals case in the tissue. Surgical explanation show extensive tissue necrosis. Culture from the site reveals gram-positive ROS. Okay, so now let's come to the options. So what do you think?
Phospholipid splitting.
Lipid splitting.
Yeah, it's a case of gas gangrene, right? And I told you the Clostridium perfringens produces this alpha toxin, which causes cell death of the tissue, and some of the great degradative enzymes they produce this hydrogen gas, which manifests as gas gangrene. Um, you see on palpation, you hear this crepitus sound, right? What about the actine depolymerization?
Diphtheria
Difficile.
with
Yeah, it's they're talking about C. difficile, right?
Yeah. Cytoxin B.
The carbohydrate degradation. So we have not done this one, but it's by diphtheria toxin. Okay, they work by inactivating the elongation factor 2 through ribosylation, right? Um, okay, the C option of elongation factor ribosylation, right? Then we have plasminogen activation. Which enzyme or which toxins does this?
Streptokinase.
Yeah, perfect. Streptokinase. Streptokinase is produced by which bacteria?
Pyogen.
Yeah,
Strep pyogen.
Strep pyogenes, right? What about the option if presynaptic synaptic acetylcholine release?
Botulinum toxin.
Sorry?
Is it botulinum toxin?
Yeah,
Yeah.
botulinum toxin. T cell hyperstimulation.
The
Super antigen.
super antigen.
Yeah, it's a super antigen. Perfect. So the correct option is phospholipid splitting, right? So we have a lot of toxins over here. Let's just quickly go through them. So we have diphtheria it inactivates EF2, ligation factor 2 via ribosylation and blocks protein synthesis, right? Pseudomonas aeruginosa, we are going to discuss all these, right? So we have exotoxin A and it also works by EF2, right? Staph aureus, it produces toxin, TSS, and enterotoxin. Both work as super antigens, right? C. diff, the cytotoxin B, exotoxin B, it works by actinium depolymerization. Botulinum, it blocks the synaptic release of acetylcholine. Okay. Pertussis toxins, it was by GI ADP ribosylation. Cholera toxins, it was by ADP ribosylation, just like which one?
Portotella pertussis.
Yeah, perfect. Classium perfringi has got this alpha toxins, which is a phospholipase, and it splits the phospholipids. It causes cell lysis and tissue necrosis. So did you guys understand this question?
Yeah. Yes.
Perfect. Who is going to read this next question?
I can do.
Mhm.
Which of the following pathogens is most likely responsible for this patient's current condition? A 46-year-old HIV positive man is hospitalized with fever, cramping abdominal pain, and watery diarrhea. Evaluation shows high fever, hypotension, tachycardia, and lower abdominal distension and tenderness. Abdominal X-ray reveals free intraperitoneal air, and the patient is taken for urgent exploratory laparotomy. Operative findings include erythematous and dilated colon, a focus of bowel wall necrosis with a perforation is resected. Histopathologic analysis reveals acute inflammatory changes, epithelial necrosis, and a layer of denuded epithelium, fibrin, and inflammatory cells overlying the mucosa. Which of the following pathogens is most likely responsible for this patient current condition?
All right. So the patient is presenting with watery diarrhea. Okay. And on histopathologic condition, you see acute inflammatory changes, epithelial necrosis, and layer of denuded epithelium, fibrin, and a lot of inflammatory cells, leukocytosis, right? So what do you think this patient is having?
Clostridium.
Clostridium difficile.
Is it Clostridium difficile?
Yeah, this is a case of Clostridium difficile, right? And what are the toxins which causes this
B.
yeah,
Exotoxin B.
exotoxin B, right?
Mm.
So next question.
Which of the following components of the intestinal mucosal cells? A 65-year-old man comes to the office due to pain, redness, and swelling in his right calf. The patient is diagnosed with cellulitis and clindamycin is initiated. A few days after starting treatment, he develops watery diarrhea and abdominal cramps. The patient is hospitalized and incomplete blood count reveals leukocytosis. The toxins responsible for this patient condition most directly affect which of the following components of the intestinal mucosal cells?
Mm-hmm. So what do you think this patient is having?
Clostridium difficile.
Okay, what are the important clues?
Clindamycin.
Yeah,
Yeah.
clindamycin.
Yeah, also he's having watery diarrhea. Another important um, clue.
Leukocytosis also.
Yeah, we have leukocytosis or a lot of neutrophil, right? So correct option is
Option C.
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 Brush
right.
border.
C.
Yeah, cytoskeleton integrity, right? So C. diff risk factors are recent antibiotic use, hospitalization, gastric acid suppression. Why is this PPI or risk factors?
Because more gastric acid, it will kill more of the
Yeah,
acid.
it actually provides a barrier for a lot of bacteria, right? Pathogenesis, disruption of intestinal flora, C. diff overgrowth, right? Toxin and B causes disruption of cytoskeleton integrity and causes inflammation, pseudomembrane inflammation. Clinical presentation will profuse diarrhea, leukocytosis, and fulminant colitis. Diagnosis is PCR, stool elicitis, right? Treatment is fidaxomicin or oral vancomycins, right? IV metronidazole added for fulminant diseases. Next question.
Which of the following is most likely to confirm the diagnosis in this patient? A 5-month-old boy is brought to the emergency department due to poor feeding, weakness, and complete loss of extremity muscle tone. He has had no fever or vomiting, but stool frequently has decreased. Vaccination are up to date and there is no significant medical history. The patient receives formula as his sole source of nutrition except for occasional fruit juice and honey. Physical examination reveals an alert but floppy infant who has a weak cry and diminished gag reflex. Which of the following is most likely to confirm the diagnosis in this patient?
Mm-hmm.
This patient is taking honey, that means Clostridium botulinum spore.
Yes.
Toxin.
Yeah, the patient is presenting with botulism, right? Poor feeding, weaknesses, and complete loss of extremity muscle descending paralysis, right? Um, Vaccination are up to date. He's taking a lot of honey, right? And physical examination is fluffy and faint, right? And there is diminished gag reflex. It's one of the important characteristic in a patient with floppy baby syndrome, right? So which of the following is most likely to confirm the diagnosis in this patient? So what do you think?
Botulinum toxin.
Yeah, it's botulinum toxin. So coming up to the options,
C.
cerebral,
C.
yeah, stool test for toxin assay, right? Infant botulism, injection of Clostridium botulism spore, um, dust, soil, or honey. Spores colonize an immature gastrointestinal tract and produces toxins. What is the difference between infant and adult botulism?
Cause in infants, mostly caused like with honey ingestion. Adults can't ingestion. Also, I think the symptoms, because here have the fluffy baby, mostly in the infant. In adults, the other symptoms like flaccid paralysis and this.
Yeah, so in infant, it is caused by ingestion of spores, which colonizes the GI due to lack of robust flora, right? And in adults, it is caused by direct, or preformed toxins, right? Clinical presentation will be age less than 12 months, constipation, poor feeding, hypotonia, oculobulbar palsies like abscess reflexes, ptosis, symmetric descending paralysis, right? All right, who is going to read the next question?
Okay, patient most likely developed infection from which of the following bacteria? Um, an epidemiologic study is conducted after sudden increase in the rate of the severe postoperative infections in a rural hospital. It is determined that all the patients who developed infection operated on with surgical instruments sterilized by a specific autoclave machine. The machine was found to be inadequately sterilizing the equipment due to malfunction limiting the temperature to 100 centigrade during the 15-minute cycle. The patient most likely developed infection from which of the following bacteria? Is this the Purkinje, maybe?
Well, why Clostridium perfringens is the right option?
I think it has to do with the temperature.
Sorry?
125 degrees Celsius for 15 minutes.
Yeah.
Yeah, it's a spore farmer, so you need a lot of temperature to sterilize these autoclave machines or these instruments, right? So you need at least 134 degrees Celsius to kill these spores, right? Same goes for the other species like Bacillus or other Clostridia species. So there is inadequate sterilization and Clostridium perfringens form spores, right? So
Yes.
that's why the other group of bacteria, they don't form spores. So the correct option is Clostridium perfringens, right?
Yes.
Did you guys understand this question?
Sorry?
Did you guys understand this question?
Yes, because of the heat, too many about the spores are not dying at some certain temperature. So we need to establish higher temperature to kill them.
Yeah, that's right. All right, next question. Who's going to read this one for us?
Okay, which of the following is the most likely path taken by agents responsible for these patients' neurologic symptoms? A 42 years old homeless man comes to the emergency department due to painful muscle spasm. The patient has had frequent involuntary contractions of the jaw, neck, and trunk muscles, which are triggered by sensory stimuli. He has history of injection drug use and has had several injection site infections. Physical examination shows neck stiffness and decreased opening of the jaw. Which of the following is most likely path taken by the agent responsible for the patient's neurologic symptoms? It looks like tetany, colostrum tetany, right? And hold on, let me see.
So,
Puncture.
Motor neurons, spinal cord, interneurons.
Yeah,
so this patient has
maybe
involuntary
IV
contraction.
drug. I don't know. Maybe there
Yeah.
some injection you see site, several injection site. That is the way maybe.
So the patient is presenting with contraction of the jaw, which we call trismus, neck and trunk muscles. We have opisthotonus, right? He has a history of injection drug use. So, what are the risk factors for Clostridium tetani? How
Because
does it get into the
Contaminated,
body?
contaminated area.
Sorry?
Usually,
so
contamination maybe at birth. It can also happen for kids and for adults. Contaminated the wounds.
Yeah,
yeah,
it gets
Like soil,
it's
nails.
yeah,
yeah,
it's
by
like anything soil. Yeah, absolutely. So then it's
yeah,
getting to the bone. I mean, to body. Then it's gonna be like a retrograde, right? Retrograde transfer, axonal transport is gonna go to the I think central
Ventral.
nervous system.
yeah.
Then
So these spores are actually found in the soil, and they can get into the body through a wound site. Okay, I told you it also can get into the body. In drug users, they use this skin popping technique, right? It can also get in case of neonatal tetanus due to contaminated umbilicus or circumcision wound. They can get into the body, right? So, what is the pathway of Clostridium? This
I think it's F is right there. Puncture wound, motor neuron, and spinal cord in interneurons, maybe.
Yeah, puncture wound, motor neuron, spinal cord neuron. That's the correct option, right?
Yes.
Sir, can you please comment on option C? Like in which condition we will see this?
Infected wound, systemic circulation, brain, parenchyma. So that could be for Staph aureus. Okay.
Okay.
Like in case of meningitis. Um, Also, it can be in case of GBS, the in case of like group B streptococcus, right? So
Okay.
it can cause meningitis, right?
Thank you, sir.
Contaminated food, systemic circulation, then presynaptic nerve terminals. What do you think about that? Sorry?
Clostridium botulinum.
Yeah, Clostridium botulinum, right? What about the option A?
That is a dog
Rabies.
bite.
Rabies?
Yeah,
Rabies.
yeah,
Yeah.
perfect.
Yeah.
Rabies. Um, Nasopharyngeal exudates, then systemic circulation, then neurons. It's about
Difficile?
no,
Is it
No. Okay.
meningitis? Maybe.
no diphtheria. You can
Oh,
say.
Oh.
diphtheria. Okay.
All right. So
Mm.
this is the pathway I already discussed with you, right? All right. Next question. Who is going to read this one?
Which of the following steps in neuromuscular transmission is most likely affected in this patient? A 46-year-old man is brought to the emergency department due to worsening blurry vision, difficulty swallowing, and dry mouth for the past hour. The patient has also been having nausea and abdominal discomfort but no headache or fever. He has no prior medical condition and takes no medications. The patient has not traveled recently but he attended a community potluck event yesterday where he sampled home canned foods. Physical examination shows bilateral ptosis and sluggish pupillary response. Which of the following steps in neuromuscular transmission is most likely affected in this patient?
Mm-hmm. So what do you think? We have A, B, C, D, E, and F, right?
D.
D, right? So once like ABC, it shows ABC, it shows the synthesis of acetylcholine. Once choline is taken up by these neuromuscular ending, right? Then it is combined with acetyl-CoA, it form these acetylcholine. Then these acetylcholine, they are packaged into these vesicles, and then the snare protein actually helps in the exocytosis of these vesicles into the neuromuscular junction, right? So option D is our correct option, right? Did you guys understand?
Doctor.
Yes.
All right. Now, what about the option E? The choline and acetylcholine is actually broken down into choline and acetate. Which enzyme does this?
Choline stress.
Yeah, acetylcholine esterase, right?
Yeah.
Okay. Next question. Who is going to read this one?
The substance administered to this patient is derived from bacteria that most likely demonstrate which of the following characteristics. A 40-year-old woman is evaluated for neck pain that has gradually worsened over the past several months. The patient reports a pulling sensation in her neck that causes difficulty in keeping her head straight. She has no history of neck trauma and has no other medical condition. Physical examination show a spastic and thickened sternocleidomastoid muscle causing head tilt. The patient is diagnosed with idiopathic torticollis. She is treated with injection of a bacteria product into the affected muscle with significant relief of the symptom. The substance administered to this patient is derived from bacteria that is most likely demonstrate which of the following characteristics.
So,
Is this a botulism?
yeah,
Botox
it's
injection.
Botox. Yeah, Botox. It's Botox injection extracted from Clostridium botulinum, right?
Subterminal spore formation.
Yeah, subterminal spore formation is the correct, right? So which bacteria produces endotoxin?
Gram negative.
Yeah, most of the gram-negative bacteria, elementary bodies, chlamydia or mycobacteria, they produce these. What about option B?
Antifagocytic capsule. Like strep pneumonia,
Staph aureus?
influenza.
Yeah, strep pneumonia, Klebsiella, and all those. Antigenically hypervariable pili, they are Neisseria, they're talking about Neisseria, right? Okay, so this is the same thing that we discussed. Now, next question.
Further review of this patient medical history would most likely reveal which of the following. A 34-year-old man comes to the hospital due to difficulty swallowing, dry mouth, and blurred vision that began several hours ago. Examination shows mydriasis and poorly reactive pupils. Electro- uh, electro- Electrodiagnostic studies reveal normal nerve conduction velocity, but decreased compound muscle action potential. Rapid repetitive nerve stimulation lead to facilitation of CCAM. Further review of this patient medical history would most likely reveal which of the following.
So they are asking about the history. The patient presented with difficulty swallowing, dry mouth, and blurred vision, all those muscarinic block receptor symptoms. Address
Is
and
this looks like a D or no?
no.
The A,
Uh,
acute consumption of home canned food.
Yeah, they are talking about botulism, right?
Yeah.
There is masculine. There is acetylcholine, no acetylcholine, right? And repetitive stimulation causes facilitation of this compound muscle action potential. So consumption of home canned food is the right option, right? Okay. So this patient combined nicotinic muscarinic blockade like diplopia dysphagia is suggested to impair acetylcholine release. Mechanism is characteristic of botulism toxin, highly potent neurotoxin that cleaves SNAP protein, right? The anaerobic environment within certain food that are permanently preserved or can at home allows for germination and growth of the organism with subsequent toxin production by vegetative bacteria. Toxin release right heat by heat. However, if food containing the toxin is not cooked properly, the classic findings will be diplopia, dysphagia, and dysphonia. Neuromuscular effects of botulism can be seen on electromyography as decrease in the compound muscle action potential because there are no acetylcholine, right? Following stimulation of motor neuron. However, high rate repetitive nerve stimulation improves the deficit because a rapid depolarization rate increases calcium concentration in the presynaptic nerve terminal, helping mobilize additional acetylcholine vesicle, right? Option B, diarrheal disease after eating undercooked poultry. So that is Guillain-Barré syndrome triggered by Campylobacter jejuni. Option C, episodic diplopia enterosis are particularly myasthenia gravis, right? Poisoning due to organophosphate used in insecticide reflect depolarizing blockade. Tetrodo- Tetrodotoxin poisoning due to contaminated puffer fish ingestion leads to inhibition of sodium influx into nerve cells. All right, next question. Who is going to read this one?
Release of which of the following neurotransmitters is most likely to be directly impaired in this patient? A 4-year-old boy is brought to the emergency department with dehydration. He has had several days of decreased oral intake. Today, his parent could not get him to drink anything. The patient has received no vaccination due to parental beliefs. Vital signs are normal except mild tachycardia. Physical examination shows decreased skin turgor and sunken eyes. His jaw muscles are tight. Neurological examination shows increased muscle tone and 3 plus patellar reflexes. There is small heel puncture wound on his left leg. The father says that the boy fell on a piece of chain link fence in their backyard last week. Release of which of the following neurotransmitter is most likely to be directly impaired in this patient?
Glycine.
Yeah, it's a
GABA and
case of
glycine. Tetany. Clostridium tetany.
yeah, it's a case of Clostridium tetani, right? What are the important clues? So in the stem, they are going to divert your attention. For example, like they just give you some clues. Patient presented with dehydration, decreased oral intake, and these all symptoms are due to locked jaw, right? And there is mild tachycardia. So examination also show increased tone and these reflexes. This is due to the overfiring. But there is a puncture wound, right? So important release of which of neurotransmitter is. So acetylcholine, right? There is two.
GABA and glycine. D. Glycine.
Glycine is the correct option, right?
Yes.
All right, next question.
Okay. Which of the following most likely protected this patient from developing neurological symptoms of the infection. A 7 year old boy evaluated for a foot wound. He sustained a splinter injury to his left foot while playing in the yard several days ago and has continued to have purulent discharge from wound. The patient had no significant medical history and is up to date with all recommended vaccinations. Wound examination revealed a small retained foreign body with surrounding necrotic tissue and pus. Anaerobic culture of the wound swab grows thin gram-positive rod with terminal spore, which is biochemically infected as a Clostridium tetani. Which of the following most likely protected this patient from developing neurological symptoms of the infection?
Mm-hmm. So they're asking about the Clostridium tetani. Okay, so what do you think is the correct option?
C.
E.
Circulating antibodies that neutralize bacterial
Yeah,
pathogens.
I also think E.
Okay, so which type of vaccine do we give in case of Clostridium tetani?
It's like a
Right.
killed vaccine, right? Killed.
Yeah, we give a toxide, right?
Mm.
So what does which type of
Neutralize
immunity?
the bacteria product.
Yeah.
Yeah.
So correct option is circulating. Yeah, so it produces a humoral, a long-lasting immunity with antibodies which neutralize these toxins, right? In case a person sustain or gross wounds, so we also give them some immunoglobulin as well. Okay, so those immunoglobulin are those antibodies I told you about. They actually neutralize the action of these, like these antitoxin actually neutralize, right? Option E, sensitize CD8 or these CD cytotoxic lymphocytes capable of killing bacteria is not right because the CD8 cells they actually kill um, um,
MHC1.
yeah, in case of viral infection, right?
Yeah.
So it's an important host defense, right? Okay. Activated macrophage capable of killing bacteria. Why do you think it's not the correct option? In which condition do we have activated macrophage?
Is it in TB?
Yeah, in
Um,
case of
TB.
yeah, in case of TB, we have these activated macrophage and the granuloma we discussed, right? Circulating antibodies that activate complement. It's actually not the correct, right? Neutrophil infiltration of the wood with lysosomal enzyme release. It could be like the first line of defense, but it does not last for longer, right? So correct option is C. All right, next question. Who is going to do this one?
No one want to read?
Which
Is
of
it
the
In
following
addition to,
intervention
okay. In addition to hygienic umbilical cord care, which of the following interventions would have most likely prevented this neonate condition? A 6-year-old boy is brought to the emergency department due to the inability to feed for 12 hours. The parents report that he has been unable to open his mouth and has had clenched hands all day. The neonate was delivered at home by the grandmother. After the umbilical cord was cut with a kitchen knife, parents rubbed a coin on the umbilical cord stump to promote wealth during the child's life, as is customary in their culture. The mother did not undergo parental care, but says the pregnancy was uncomplicated. Physical examination shows increased muscle tone throughout, aching of the back, and dorsiflexed feet. So in addition to hygienic umbilical cord care, which of the following interventions would have most likely prevented this neonate condition?
So what does this neonate has?
It's the tetanus,
Tetanus.
right?
Tetanus.
Confirmed
Yeah,
tetanus.
the neonatal tetanus that I told you about, right? And it is due to this unhygienic practice of our contaminated umbilical cord, right? So what is the correct option?
D. Vaccination of the mother during pregnancy.
Yeah, vaccination of the mother during pregnancy. All right, next question.
Which of the following agent was most likely initiated in this patient? A 62-year-old man is hospitalized with severe abdominal pain and diarrhea after recent urinary tract infection. 6 months ago, the patient had an episode of Clostridium difficile colitis after being treated for pneumonia. Medical history is also significant for diverticulitis and upper gastrointestinal tract bleeding. Patient is allergic to penicillin. An appropriate workup confirms C. difficile colitis. He is administered an oral macrolide antibiotic that inhibits the sigma subunit of RNA polymerase. Which of the following agent was most likely initiated in this patient? Vancomycin E.
Fidaxomicin.
No.
So first is the Vinco, and I think second was the fidaxomicin, if I'm not wrong.
Well, we have
Is it D?
okay, D-neomycin, no.
Macrolide. Which one is macrolide?
Doxycycline,
Vincoris.
no.
Doxycycline?
No.
Vin
If
B?
you read,
Vinco.
yeah, if you read the
Fidaxomicin?
stem, yeah, I told you about the treatment of C. diff, right? The first line of drug is vancomycin.
Yeah, because it's saying where oral, because other are not necessary in oral. It's oral macrolide.
But allergic to penicillin.
It's a macrolide.
No. Vancomycin, how does vancomycin work?
Cell synthesis.
It's like
GALA.
Yeah, yeah.
Cell wall.
Yeah, it inhibits the cell wall, right? But over here, we have
yeah, this person is allergic to penicillin, so I think we
yeah,
cannot make
they're saying he is administered an oral macrolide antibody that inhibit the sigma subunit of RNA polymerase, right? Sigma subunit specifically of the RNA polymerase. Doxycycline is also macrolide, but it binds to the 30S ribosomal unit, right? Fidaxomicin is the correct option over here, right?
Okay.
Yeah. So, Clostridium difficile, just quickly go through this table. Recent antibiotic use, I think we already did this one, right? Let's do this fidaxomicin, right? So, fidaxomicin is a macrolide antibiotic that inhibits the RNA polymerase sigma subunit, the component node in the promoter DNA. We have this promoter region over here. And so that transcription can be initiated. Inhibition of transcription leads to impaired protein synthesis and eventually cell death. It's a bactericidal. Fidaxomicin is administered orally and has a minimal systemic absorption, resulting in high concentration in the colon and PCs. It also has a narrow spectrum of activity with lesser effect on normal colonic flora than vancomycin. All right. Next question. Who is going to read this one?
Sir,
Mhm.
in the last explanation, I saw that they treat it with vancomycin as well in the explanation.
Yeah, but if you see, they specifically mention that he has administered an oral macrolide that inhibits the sigma subunit of RNA polymerase. Vancomycin is the first line of drug, but they are talking about another antibiotic, another macrolide that specifically inhibit the RNA polymerase, right?
Yeah, thank you.
Do you have any confusion?
No.
All right, next question.
Which of the following is the most likely cause of the patient's symptom? A 24-year-old man comes to the emergency department due to severe nausea and vomiting 2 hours after a church picnic. He ate chicken salad and had been sitting out in the sun. The patient has no prior medical condition, temperature 37.2, blood pressure 126 by 84 and pulse 86. No abdominal tenderness is present. The bowel sounds are normal. Blood cell counts and serum chemistry studies are within normal limits. Symptom improve significantly within several hours with supportive care. Which of the following is the most likely cause of this patient's symptom?
So what do you guys think?
Is it Bacillus cereus? Poison?
Why it's Bacillus cereus? Cereus we
Was is it
discussed.
that
Let's.
stuff toxin? Because like 2 hours and this chicken salad maybe had mayonnaise.
Or
I don't know.
Yeah, you are actually right. So it's a Staph aureus enterotoxin. It is due to the ingestion of free form enterotoxin, right? Um, and uh, there is rapid onset illness. It's a super antigen, right? So we have nausea, vomiting, and abdominal pain. High risk foods are like chicken salad. You specifically remember this one, and all those like mayonnaise, meat, eggs, etc. So all these are come under the high risk food. Okay.
Yeah.
Okay.
I think then also timing, right? Timing is like it's eating after like a 2 hours, like a very early.
Sorry. Yeah, the timing is actually important. So it causes Staph aureus enterotoxin. It is in rapid onset of illness. Okay,
and,
over
and,
here.
and how can we differentiate between that exotoxin, endotoxin, and introtoxin? It's just memorization.
Yeah, it's just memorization and a lot of MCQs that you will come. There are a lot of bacteria associated with the gastrointestinal tract. We'll discuss them further. There are a lot. And a lot of bacteria have like the same clinical presentation. So like you can differentiate based on like the onset. Either there is a diarrhea associated or not, whether it's a bloody or watery diarrhea. Like they'll just give you some small clues, and you need to differentiate based on those, right?
Sir, I have a question.
Mhm.
So, in this question, like, why not Bacillus cereus? Because the timing is 2 to 4 hours. So, according to the table, they are
Bacillus
saying that
cereus,
yes.
yeah, Bacillus cereus. I told you it's in high carbohydrate foods like reheated
So,
rice.
rice, pre-cooked rice. Okay.
Yeah, reheated rice, right?
Okay. Thank you. Yeah, got it. Got it.
That's why it's not Bacillus cereus. So, major pathologic mechanism of foodborne illness, enterotoxin, and this test. So we have two, Staph aureus and Bacillus cereus, right? So, in case of Staph aureus, we have quick onset, 1 to 6 hours. Bacillus cereus vomiting. In both of them, vomiting is predominant, right? Enterotoxin made in intestine, so Clostridium perfringens, when we studied, then we have these E. coli toxins, and we have Vibro cholera, so they will have delayed onset and watery, bloody diarrhea. Bacterial epithelial invasion, Campylobacter jejuni, non typhoidal salmonella, and Listeria monocytogen, variable onset, water, bloody diarrhea, fever. So, all right. Enterotoxigenic Staph aureus is the leading cause of foodborne illness. This pathogen inoculates food during unsanitary preparation by an asymptomatic carrier. Storage of the food at room temperature for extended period, picnic or hot meal, allows the bacteria to proliferate and generate a heat-stable enterotoxin. Ingestion of the preformed toxin leads to rapid onset illness that include nausea, vomiting, and abdominal pain. Occasionally, mild fever and diarrhea may also be present. Because of the disease is due to ingestion of free form toxin, no person-to-person transmission occurs. However, outbreaks may arise when people eat the same contaminated food at an event or party. High-risk food includes dairy products, produce pre-cooked meat, eggs, mayonnaise-based salads, chicken salad, right? Similar clinical very rapid onset nausea, vomiting, abdominal can be seen in food like Bacillus cereus, which also produce a heat-stable enterotoxin. B. cereus contaminates starchy food, rice, and this is often associated with reheated rice. So, did you guys understand this question? All right, next question. Who is going to read this one?
Which of the following is most likely bacterial virulence factor contributing this patient's condition? A 34 years old man come to emergency department due to 2 days of fever, malaise, and myalgia. He also had worsened shortness of breath and cough. The patient work in the mail room at large company, does not smoke cigarettes and drink alcohol occasionally. Chest imaging shows lung infiltrates and prominent widening of mediastinum. Sputum and blood culture yield large gram-positive rods that form colonies resemble a medusa head. Which of the following is most likely bacterial virulence factor contributing to this patient? Bacillus anthrax.
Yeah, it's Bacillus anthracis, right?
Medusa
And
head.
okay,
Option A.
A.
yeah, antiphagocytic D-glutamate capsule. So, which kind of manifestation does this patient present with? Which type?
Pulmonary and
Yeah, he has a widened mediastinum zone,
mediastinitis.
pulmonary anthrax. So, um, how does the transmission occur?
Spore.
Mm-hmm.
Inhalation of spores.
Yeah,
Yeah,
inhalation of
so first of all, they are found in the soil, right? They can get
Mhm.
into the dairy products, they can get into the like sheep, wool, all those things, and from there they can be inhaled by. But this patient is working in the male room. Is this a risk factor?
Yeah,
Yes, sir.
especially if like
Paper.
as a weapon,
Yes.
Yeah.
biological weapons.
Yeah, so before, like this was actually used as a biologic weapons. Um, like I think in the World War II, in the US, there are a lot of males contaminated with the spores of this Bacillus anthracis, and a lot of like there were around 18 deaths occurred. So and it can actually be used as a biologic weapons. For example, in wars, it can also be mailed using like these. So opening these males can actually these contaminated males can actually expose the person to bacillus anthracis, right?
Yes.
Okay. All right. Next question. Who is going to read this one?
Okay, I will read. The microorganism most likely responsible for this patient's condition is also currently associated with which of the following condition? A 35-year-old man is admitted to the hospital after he fell off of a moving tractor and caught his right leg underneath the vehicle. The the patient has no past medical history. Over the next few hours, he developed worsening severe pain and rapidly increasing swelling in the injured right leg. Crepitus is present on physical examination. Emergent radiographic image reveals gas in the tissue. Surgical evaluation is performed. The microorganism most likely responsible for this patient condition is also currently associated with which of the following condition? Which of the following conditions? Sorry.
Okay, no worries. Thank you for reading. So, what do you guys think this patient is having?
Clostridium perfringens.
Yes, gangrene.
Gas gangrene.
Yeah, gas gangrene, right? And what is the correct option?
D.
D. Watery
D.
delirium.
Yeah, the answer should be D, gas gangrene.
So, Clostridium perfringens manifests as either gas gangrene or it can also cause food poisoning. So, transient watery diarrhea and abdominal discomfort is the right option. Okay, next question.
Okay, which of the following pathogen is most likely responsible for the patient's condition? A 36-year-old man is admitted to the hospital with severe leg pain after suffering a minor laceration to the leg 2 days earlier. Temperature is 39.5 and the blood pressure is 85/45. On physical examination, left leg is swollen and firm with erythema or the erythema of the overlying skin. There is small wound draining vomiting exudate on the left calf. The patient is taken to the operation room immediately, and large area of the necrotic tissue is excised. A gram stain of the necrotic tissue shows gram-positive cocci and culture of the bacteria perform and blood gas agar plate grow small colonies with wide zone of the surrounding hemolysis. Coagulase and catalase tests are negative and peritoneal arlamidase test is positive. Which of the following pathogen is most likely responsible for the patient's condition?
All right. So this question is actually we discussed yesterday, but I have included to let you know that you should read the whole stem, right? So a lot of students, what they do is they actually read the first 2, 3 lines and then they like rush through the MCQ, right? So this could be a presentation of C. perfringens, although there is no gas gangrene, etc. But like there's a lot of similarities. So you should read the whole MCQ stem before jumping to the conclusion. So what do you guys think is the correct option?
E. Biosis.
Yeah, strep pyogenes is the correct option. All right, last question.
मैडम अंदर तो आना गाड़ी मारेगी पहले अंदर आ जाओ फिर बात करो ना We were supposed to go pray.
Which of the following is the greatest risk factor for this patient's current condition? A 70-year-old man is hospitalized due to abrupt onset severe left thigh pain with no preceding trauma. Temperature is 38.9, blood pressure is 90/60, and pulse is 120. And respirations are 24 per minute. Left thigh examination shows diffuse swelling with dusk skin discoloration and several bulli filled with hemorrhagic fluid. There is significant tenderness and crepitus on palpation. Gram staining of the bulli fluid reveals numerous gram-positive rods, and subsequent culture grows Clostridium septium. Which of the following is the greatest risk factor for this patient current condition?
All right, so we did not discuss this Clostridium septicum, but it is really normally found in the
Malignancy. Yeah.
colonic
Malignancy.
mucosa, right?
Yeah.
But like there are, like we discuss the C. perfringens, right? How does this C. perfringens get into the body?
Contaminated wound.
Yeah, through any trauma, right? So we call
Yeah.
that uh, traumatic gas gangrene, or um, like we call it traumatic gas gangrene, right? For example, like during military wounds or RTA, etc. But this C. perfringens actually colonizes the colon. Normally, it is non-pathogenic, but if there is any portal of entry which they can use to disseminate into the blood or into the body, then that could be a risk factor. So colonic malignancy is one of the risk factor, and in colonic malignancy, the underlying mucosa is evaded, and it actually creates a portal of entry for this bacteria. Other other risk factor could be inflammatory bowel diseases like
Crohn's.
yeah, Crohn's, right? So they can use it to get into the or disseminate into the blood and then cause. So it will be called non-traumatic gas gangrene or spontaneous gas gangrene, right? So colonic malignancy is the right option. So this was all for today. So do you guys have any questions?
So, sir, are we going to do the hematology and micro on the alternate days?
Um, yeah, we are actually planning to do so. Um, but we will let you know. It is not been decided yet, but most probably we will do it on alternate day. Um, one day will be for macro and the other day will be for hematology.
Okay, thank you.
Okay. Thank you.
All right. Do you guys have any questions?
Yes, so after we finish hematology, what's the other system you'll be doing?
After hematology, we will do the neuro, and then we have, I think, which systems left?
Repro, reproduction,
CNS,
Reproduction.
repro.
Repro, yeah,
Okay.
we'll do.
biochem.
Yeah, we'll do the repro first, and then we do the immunology and other general principles, right?
Yeah, that'll be good to do general principles and the others. It's good to finish the systems first, right? Like y'all had planned.
Yeah, that's right.
That's good. Thank you, doctor.
All right, thank you so much for joining. Hope you enjoyed the session. See you tomorrow. Have a great day. Bye. Take care.
Thank you, sir. Bye.
Thank you. Bye.